Thank you very much for giving me the opportunity to address a global perspective on facing change in medicine. In this time of great social turmoil, there is no doubt that the problems confronting our society, and particularly the ones the medical community struggles to address, require changing many of our routine practices. We often get stuck in a local mindset, using the same tools and techniques that we have used in the past. But seeing these problems we face from a global perspective has taken on a new meaning this year with the COVID pandemic, a global problem requiring a global solution. But just as the recent novel corona infection developed in China and not long ago Ebola emerged from Africa, both producing health threats here and around the world, so too do the changes in our healthcare systems impacting physicians create global impact. For me, having spent time working and traveling in many other countries, I can share with you two general truths. One is that the frustrations we feel with inefficient technologies, third-party payers, and government regulators, while universal, are not insolvable. We can learn valuable lessons looking at other countries. Secondly, the reaction of physicians to the dehumanizing aspects of healthcare are the same in New Zealand, Myanmar, China, and Haiti as they are in the United States. It is documented in the medical literature, and I have experienced it myself, so you are not alone. A November 2, 2019 editorial in the British journal The Lancet was entitled, "Physician Burnout: The Need to Rehumanize Health Systems." This article identifies the triad of emotional exhaustion, depersonalization, and reduced professional efficacy, defining burnout as a detriment to care and to retaining workers in our medical workforce. The international scope of burnout is cited in another Lancet article last November, referring specifically to China. The scarcity of high-quality primary healthcare provision in China puts additional pressures on secondary care systems, making the country's hospital doctors particularly vulnerable to burnout. And this article was published November 2nd, before the coronavirus outbreak even began. Emotional stresses on healthcare workers have certainly been aggravated by the COVID pandemic. We have all been made aware of the stress of managing the ill patients, wearing PPE, and reconciling disparate views of the pandemic with those of differing political perspectives. But there is also the very real harm that healthcare workers face, as described in this World Health Organization YouTube video. In October 2018, the incoming president of the World Medical Association, Dr. Leonid Eidelman, started his inauguration speech by addressing the pandemic of physician burnout. At that time, surveys showed nearly half of the world's 10 million physicians had symptoms of burnout, including emotional exhaustion, interpersonal disengagement, and a low sense of personal accomplishment. There is nothing to suggest this problem has improved in the past 2 years. The same problem was evidently apparent 4 years earlier when many of the same words from Dr. Eidelman's speech were first delivered at the Canadian Medical Association. The immediate result was an accusation of plagiarism, but the more obvious conclusion is that this problem is pervasive, long-standing, and global. Some point to the dissatisfaction of spending time on paperwork, computer work, or administrative tasks. This increasing burden exists everywhere. Many studies have shown that physicians working with electronic records spend as much time with the computer as they do with the patient. This is a deep source of frustration for many. Some might say the root of the problem is simply time and money, but despite wide disparities in income throughout the world, the sense of burnout is fairly consistent. And this slide showing average compensation levels worldwide would suggest that American physicians would be the most content, but they are not. What physicians around the world find most rewarding seems to be a feeling of gratitude associated with physician-patient relationships, a feeling of competency at what they do, and believing they are making the world a better place. Not surprisingly, this pattern is not followed so much in lower-income countries like Mexico and Brazil, where income ranks higher. American physicians will often justify their higher compensation on the basis of higher educational costs and longer training periods. But as you can see, these higher costs are not unique to this country and are quickly made up by future earnings. While addressing physician satisfaction, productivity, and burnout, it is probably helpful to distinguish between how physicians feel about the medical care they deliver versus how they feel about the healthcare system in which they work. There is surely a sharp distinction to be drawn between the medical care we provide and the healthcare industry we are part of. Medical care is what we are all trained to do: take a history, examine a patient, order the right tests, interpret all this information correctly, and treat patients medically and surgically on a sound evidentiary basis. Healthcare, on the other hand, is that massive industry of insurers, electronic medical records, and quality metric technicians which sustain and drive our practices, but often seem to have little to do with actual medical care. It is the changes in healthcare, not medical care, which often seem so stressful. And this is not unique to Santa Monica, California, or the United States. The dehumanizing threats to our healthcare system are truly global. The solution to securing a more satisfied medical workforce is not simply working fewer hours or improving compensation. The solution must come through either adapting to the necessary aspects of the healthcare system or altering those aspects which are inconsistent with providing the best medical care. 50 years ago, a book was published entitled Future Shock. The author was West Side resident Alvin Toffler. He wrote about the accelerated rate of technological and social change, leaving people feeling disconnected, stressed, and disoriented. One specific cause Toffler cited was information overload. I think we can all agree that future shock is now present shock. The book has sold about 20 million copies, published in over 50 countries, and translated into at least 8 different languages. The concept of future shock is not just limited to Alvin Toffler's West LA neighborhood. Future shock is global. But the skills to manage this shock have been in our psychic toolbox for a long time. We may only now be realizing the power that resides within us to deal with fast-moving change. Sir William Osler spoke of equanimity when he addressed graduating medical students from UPenn Medical School in 1889. Modern spiritual writers speak of equanimity as the essence of all the world's great religions. Resilience training developed by the U.S. military has now been adapted to many businesses and industries, and the practice of mindfulness is no longer just the purview of Buddhist monks. It is practiced ubiquitously in yoga studios, on professional sports teams, and throughout our school systems. In addition to these time-proven spiritual approaches, artificial intelligence holds technological promise for improving our professional lives. However, even with equanimity, resilience, and mindfulness, a health system which demands longer hours, inefficient technologies, mounting documentation requirements, and loss of personal interaction shifts the focus away from medical care of the patient to meaningless nurturing of the healthcare system. One editorial notes, "In a pressurized health system burdened with administration, changing financial incentives, outdated technology, altered professional expectations, and regulatory policies insufficiently aligned with professional values, the art of medicine itself might be corroded." Today, on top of the technological changes, the business pressures, and the emotional strain of future shock, we face a pandemic, social turmoil over race and policing, and political division like we have never seen in our lifetimes. A New England Journal of Medicine perspective article by authors from the National Academy of Medicine, the American Association of Medical Colleges, and the ACGME, just this recently on August 6, 2020, noted, "Just as the country rallied to care for September 11 first responders who suffered long-term health effects, we must take responsibility for the well-being of clinician first responders to COVID-19. The first focus of responsibility is health systems and other employers of clinicians. Organization leaders need to understand and squarely confront the unprecedented strains on their workforce." The purpose of the program suggested on this slide is to provide evidence-based support for healthcare workers, just as we demand evidence-based treatment for our patients. But one great threat to healthcare and healthcare workers comes from misinformation. Misinformation can hurt our patients, it erodes trust in physicians, and the conflict between good science and bad public policy creates stress on the physician messenger trying to reconcile the two when they conflict. False information feeds a growing mistrust of healthcare providers and the medical profession in general. Globally, according to the World Health Organization, mistrust has led to growing patient animosity, acts of vandalism, and even physical assaults on healthcare workers. The violence is reprehensible, but the cause is unmistakable. Dissemination of false information must stop. These many challenges are precisely the reason we hold programs like this and all the scores of CME programs organized, accredited, and put forth on a safe online platform by the Education Committee and clinical departments at St. John's Health Center. We want to work in concert with healthcare systems and physician organizations to improve well-being and the quality of care. Our goal is to be both responsible stewards of our institution and potent advocates for our medical staff members as we endeavor to rehumanize our health system in spite of the rapid and stressful change taking place around us. Thank you for recognizing this need for being here. Now, take a deep breath, appreciate all the good you do for others, and get ready to learn, get energized, and feel an ongoing rejuvenated sense of purpose as we invite you to meet the challenge of change.